Hi everyone, I have a team of 4 dentists here, and today we're in this dental talk. We're going to be speaking a lot about smile design tailored towards patients and common misconceptions in dentistry. And we're going to introduce ourselves. I'm Dr. Silvestrini.
I'm Dr. Alfredo Arauz.
I'm Dr. Sanchez.
And I'm Dr. Barton Santos.
A lot of patients have questions about veneers. And so we want to talk a little bit about why and when to get veneers. So typically we talk about aesthetics, function, and status quo. So let's talk about a little bit more about why patients would want to get veneers versus if they would need veneers.
Well, there's patients that come in that have aesthetic concerns. They'll have staining, they'll have discoloration of teeth, and they'll have teeth that are misshapen, and they're born that way, unfortunately, and they'll come in wanting to get an aesthetic consult for that. Is that kind of like your history with those, Bart?
Yeah, it all depends upon the patient. Some patients come in because, Instagram, especially with COVID, they're Zooming now and they see their smile and they want to be the better version of themselves. So ever since the pandemic, I feel like more and more consults have been coming in to fix their smile. So.
Yeah, and I get a lot of patients that are mainly, I get a lot of people that want to do cosmetic, but then their case is a little bit more involved. So that's something that I talk to patients about, in the sense that it's not just the aesthetics of the case is one thing, but the functionality is the most important thing.
Right.
So, yeah, so sometimes even though they come in for a veneer case and they think that just by having veneers on is going to last them, but all their teeth are cracked up. So the whole point is to diagnose correctly so that the case can be either a veneer case or it could be something called full mouth rehabilitation, where you actually have to do more than just the smile, more than just the aesthetics.
Let's double down on that. So that's more of a patient that has severe crowding or wear that's taking the teeth down, and they almost have stubs for teeth at this point. And they're coming in and their face gets collapsed. So there's a lot of facial analysis that has to go into a cosmetic case, especially if you're going to not only enhance their aesthetics, but you're going to correct their bite. Everything needs to be done correctly. And it takes a team and effort to put that together, and the education.
Also the training is the biggest thing, because I feel that, the majority of dentists, they are training to what we call single tooth dentistry. So you come in with an issue, tooth is broken, they just put a crown, they just patch up the work, but they don't take into consideration the bite. Why did the tooth break? Why is my porcelain better than your natural tooth? Natural tooth is a stronger material that we have in the body. So if that broke, why will my porcelain not break? So sometimes you have to kind of break it down and rearrange everything so that something that's going to last you longer. These cases should last you, you're investing a lot of money in them, it should last you 10, 30 years. So
I think comprehensive treatment planning is very important, and I commonly find patients coming in with pictures of their ideal smile, and I'm curious to hear about your opinions on that. If a patient comes in with a picture of their ideal smile, how do you treatment plan it?
So cosmetic dentistry is not cookie cutter. It's all bespoke. It all depends upon what the patient wants and what they're starting off with. So the biggest problem that I see with patients is they have this misconception that, it's only going to be 6 veneers. It's only going to be 4 veneers. Depends with where you started. That cocktail hour smile, when you're seeing your friend from the side, you think you only see the front 4, but you actually see 8 to 10 teeth. And if, your front 4 discolored, but the back teeth, because you've been clenching and grinding so much, have been worn down so severely, you may have to build back that smile and build up that vertical dimension. So it's not to say it's only 2, 3, 4, 5, 6 teeth. It depends upon the, individual patient when you walk.
Exactly, especially if they have to have a full mouth reconstruction because of wear or severe crowding or crossbite, that could affect the restorations, because if things are not in a good position, they will fracture, they will break, they will break down over time. So what increases longevity is planning it in a way that everything lasts longer and the correct harmony. So it's not only fixing the aesthetics, it's fixing the function and then the health, right? Because that's ultimately what we're here to do, which is to create a optimal oral health environment.
And also doubling down on that, it's some patients come in with teeth that's what they want, that what they find attractive, what they like. But a lot of the times, like what might look good in your face might not look
Right.
good in yours. So a smile is very personalized. It's very about you. And like, for example, myself, the way that I design my smiles is I don't like changing the patient's smile. I like enhancing what they naturally have. So some people have very dominant central. So the two teeth in the center are very dominating the smile, and the rest are kind of like pushed back. So a lot of dentists, they just make everything the same, aligned perfectly, but that's not the person. You're changing completely. So sometimes it's better to just make it personalized to them, so that way they still find themselves in their new smile. It's just a little bit more enhanced.
Sometimes I'll tell my patients some of the best compliments from someone that sees my patients' new smile is income.
Yeah.
They didn't go,
I did that.
What you-
It's like,
yeah.
I asked them, like, what are your parents, your family thinks? And they're like, no one notices. And I'm like, thank you. Thank you. That's what I want to go.
so subtle and yet so natural that it looks like nothing was done. And that's really the key, not only in cosmetic dentistry, but in anything cosmetic.
Want to be natural
And
as possible.
Exactly.
That's true. But then you also have those patients that they want the fake look. So sometimes.
And that brings us to another topic. What consideration should a patient take when deciding on which dentist to go to? I think every dentist has a different style. And I think we can talk a little bit more about what patients can look forward to when choosing a dentist as well, especially for these types of cases.
So my analogy on that is tattoo artists. If you're gonna get a tattoo, you spend this time looking for somebody that does what you like. So if you like realism, if you like more of a cartoon style, if you like more the American style, so you go ahead and you pick your artist based on what they do. You don't go to a guy that does American style, you ask him to do something like realistic, because it's not going to come out great. So what I tell patients is, look at my work, look at what I've done, and if you like my work, then come to me. But don't come to me asking me to do something that I don't feel comfortable with, because even though that the patient is the main concern, but I also like to feel proud of what I do, and I don't really like to deviate. I like to have my own style. So that I always tell patients that just look at my Instagram, look at my work. If you like me, come to me. If not, I can refer you to somebody else, but I want you to get, what you want, but somebody that needs to give their heart, put their heart into it. So,
The challenge that I find is, doing this for 11 years, and it's almost our job as an artist. We get commissioned by the patient, and they say, you know what, give me the brightest, whitest teeth, the biggest. And I've done cases like that, and you cherry pick what you post on Instagram. Here's the translucency, subtle, hints. But I've done cases where it's OM1, toilet all white, but that's because that's what the patient wanted. So I think the challenge lies, especially me personally, is when the patient comes for your expertise, and then you have to communicate that to the labs, like, listen, this is what I have to do. And you have to, once you're in that relationship with the patient, you're kind of married. So now my new, filtering is just trying to feel out the patient. And then if I feel like I don't feel comfortable, then I have to quarterback them to someone else.
Agreed. It's fine. And it's a relationship, right? Not every relationship's going to have a positive ending, right? There's going to be people that you're with that ultimately aren't for you. And there's patients that not necessarily will be a match for you either, depending on what their ideals are, what they want their treatments to be, and what your ideals are. The last thing that any dentist, cosmetic, general should do is do something that's out of their comfort zone, or something that they're not proud of, right? So that's a conversation that needs to be had. Once the patient comes in, you assess the patient, you do their treatment plan. As long as both parties are on the same page, then things can move forward. But if there's a disconnect, like in anything, it's just not going to be a positive outcome at the end. I think that's when headaches happen and patients get upset. So it's a matter of educating, letting the patient know what your stance is, letting them know what your style is, so that they're aware from the get-go, so that you have a better outcome.
I think the importance of that is, the temporaries, like we were talking before, that's like a big thing, because you can kind of show the patient at this point what their final smile is going to look like, even though that the temporaries, they're in acrylic, so they're missing that liveness to them. But still, at that point, you can kind of assess the smile and kind of guide it, because you can make changes.
They can live in it, they can function in it.
Exactly.
Well, it's their blueprint. It's like when you're buying a house or a property, you want to see what the interior design, what the exterior design is. And that's really the key. Temporization, that period of time that patient's in a temporary, dictates everything. Their bite, their speech, how they chew, swallow, function, and smile. So as long as they're happy with all those aspects during their temporary phase, the final product will be great as long as you're using a lab that lets you do a one-to-one transition on those temporaries, which is a topic that we'll talk about.
And there's a lot, there's a lot that goes with.
That is a really, really important part, which is part of doing the smile design. Bart, if you could go over some of that smile design process.
Yeah, so basically with every patient, you know, the reference to plastic surgery, everybody wants bigger and better, right? But it all has to fit within the framework. So if you want big teeth, you got big lips, everything's done. You just can't add, 15 millimeter essential incisors. Everything has to be within boundaries, because if you do that, you're going to start putting pressure on the joints, and eventually everything's just going to be downhill. So yeah, the smile design, that's the blueprint, and that's where we like to start off with, and that gives us a great point just to tailor to where the patient, you guys have a happy medium together. I feel that if you can't reach a compromise at that point, then that's when the miscommunication can happen, and then that's when you need to just establish a mutual point where you're going to start here and this is where we're going to end off.
But what's also important to consider is facial analysis, right? So you got to look at the way their face is shaped, the way their eyes are positioned, their lips, because even lips are very important. If the lips angled incorrectly, or if it's too bulky or too small. Obviously, we live in Miami where a lot of people get filler, and patients want brighter teeth. And what they're unrealizing is the more filler they get, the more shadowing you get on your teeth, and will make it look darker. It'll also change line angles of their face. Because at the end of the day, the lips are the framework to your smile. So if you get a huge frame on a small picture portrait, it looks a little ridiculous sometimes, as opposed to the opposite, right? So it's a matter of looking at the facial analysis, lips, eyes, the way everything goes together in order to create that perfect smile for that patient. And that has to happen in the education side in order for everyone to be happy.
And I think a lot of that has to do with like your protocol and the records that you take. So for example, when I do a smile design, I dedicate one day to just taking photos. I take about 20, 30 photos. I do videos. I'll do digital scans. I like to work more on the digital side, so I don't really do analog, which is like the original impressions and things like that. So I usually gather all this data and I ask the patient what they like, and I take that into consideration. And then, one thing that I do sometimes is like show me a picture from yourself, not somebody else, how you used to be years ago when you liked your smile. So if they have that, they can give me that. And then I relate all this information to a designer that I work close with, and then they give me a design that I can see it in 3D, and they can superimpose these teeth on the patient's face, so you can kind of see how everything will flow. After that, I get my temporaries, and then once I do the preparations, I will sit in, and then I will reassess, make adjustments to the temps, and then I scan that again so that the lab has a blueprint of what I want my finals to look like. And by then, you're pretty close to what, will be perfect for the patient.
The correct way of doing these kind of cases. However, there are opposite where some docs unfortunately aren't trained to do it this way, and they'll end up with a different set of temporaries than their finals, and that's when they'll be like, oh, but I like my temporaries more, or vice versa, and that's because there was no planning, right? So that's why it's important when choosing someone to do these kind of cases that they're aware of the steps that need to be done in order to get the best outcome for the patient.
Background. We can talk a little bit about age. So what are your thoughts on patients who come in, teenagers versus early 20s, late 20s, 30s? What patient age range do you think was appropriate or inappropriate for veneers?
So I think it's on a case-by-case basis. If I have a patient that's 18 years old, but congenitally missing, lateral incisors, if I'm able to get away with a Maryland bridge and just bond an Emax bridge, then I'll do something like that. But if they flat out want 10 veneers and they're 18 years old, and to me personally, I don't feel comfortable doing that. Other dentists maybe, but skeletally the patient hasn't reached their peak yet, so I don't feel comfortable modifying the bite. So I would typically wait anywhere between ages of 22 and 25, and that's when we can have that talk. Maybe we can go with like a resin bonded veneer.
Yeah, it's like a case-by-case basis.
Case by case. So there's kids that are born with genetic issues, right? And they'll have pitting in their enamel or dark stained teeth, and they're getting bullied in school. And that kind of situation when they're in their teenage years, which are very hard years, especially with bullying nowadays, right? And it's always been, but especially now with the social media. I think doing like a resin bonded reversible treatment plan is a very good option for those younger groups, but doing something more permanent where you're restoring with porcelain, possibly having to do some reduction of enamel at a younger age, in my opinion and my ethics, is contraindicated, just because one, that patient hasn't matured enough yet to do that, and two, just to be able to do things correctly with their facial aesthetics would be compromised, considering, as you mentioned, their skeletal growth is not done yet. You know, some people change their facial dynamics over time. So a resin bonded veneer case would be a perfect way of treating somebody in their teenage years, which is again reversible,
Right.
and something that it won't cause harm to them.
Let's start more conservatively.
Yeah.
Yeah, I think a common patient concern actually is the amount of enamel reduction that is necessary. And I think it's important to also talk about different instances in which more reduction is necessary versus the typical amount that is necessary for veneers. So we're going to talk about that a little bit.
Yes, so I think that has to do, and I also explain to patients that everything has to do with how you're designing your smile. So whenever you design a smile, you want to have a proper arch form. So I always tell patients, everything is going to flow a certain way. Now, if I have a tooth that is crooked and is out of the arch form, then that little corner is going to get reduced a little bit more. So sometimes it has to do, we're going to talk about the whole doing orthodontics versus not. So this has to do with the whole fact that it all depends on where you're coming from and your comfort level and where you're starting. So I tell patients, if everything is perfectly aligned, my reduction is so minimal. Yeah, your bite and your arch form, which is how the teeth kind of in the midline, if everything is perfectly aligned and you're in a better position.
Little misalignment.
Exactly. So my reduction, my preparation is going to be so minimal that I'm barely touching your tooth.
The reduction bases on tooth position and to develop that proper arch form, as Dr. Sanchez mentioned. If the tooth is far forward, obviously we're going to have to reduce more in the front in order to move it back into that arch. If the tooth is more lingual or pushed backwards, you have to prep more from the back to bring it more forward so that everything's thinner. The last thing you want is to have a tooth that's an inch thick. Right? So, and that's unfortunately also a problem that I'll see from practitioners that don't practice that way, is that they'll give too thick of a tooth and then they're smiling and it looks like dominoes, right? So what we don't want is that. So everything needs to be done in order to give as you mentioned, a proper arch form, and the preparation design, the amount of reduction has to do with that, and secondarily with tooth color, right? So if you have a lighter tooth on one side and a very dark tooth on the other, this tooth might only need very minimal reduction, if at any, and then the other, in order for the lab to give enough thickness of porcelain to hide that darkness, now you have to prepare that tooth a little bit more in order to get to the shade that you want at the end. So all of that is a factor in determining how much reduction, where are you reducing in order to get the proper outcome.
So there are several instances in which patients would benefit from orthodontic treatment prior to veneer therapy. So we can talk a little bit about certain situations where a patient would benefit from getting aligner therapy first, because I think it's important to also look at everything comprehensively, like we were talking. So in which instances would you recommend orthodontic therapy first?
I would say in an instance where they have severe crowding. Okay, so because as we spoke earlier, the more crowding there are, the more the teeth are out of position in the proper arch, the more tooth reduction has to be done. So in an instance where you want to be conservative in your approach, the best option is to put those teeth into a correct arch form to then enhance the aesthetics of it with veneers after the fact.
And I think that a lot of it has to do with also your comfort level. For example, I had a patient about 2 weeks ago that he came in. The guy doesn't even have a single cavity. His teeth are, he doesn't like the alignment of them. So he wanted me to do veneers. And I told the guy, look, if I'm going to perfectly align everything, I'm going to have to make crowns on almost all your teeth on the lower because they're so crowded. For me to get that correct bite, that arch form that you want, for everything to be perfect, I'm going to have to be so aggressive that I felt uncomfortable doing the case. I felt that if I was going to take on that case, I wasn't going to be able to sleep. So I told the guy, like, either I do aligners or I don't do anything. Like, but there's patients that go to all these clinics where they shave down the whole tooth, and what patients need to understand is that anything that we do is non-reversible, and anything that we do is going to expire at some point. It's going to continue to get worse. It's like I always tell patients, every time a tooth is touched, it's just downhill from there. You know, when today's a filling, it becomes a larger fillings, it becomes an inlay, it becomes a crown, it becomes an extraction, it becomes an implant, and so on and so forth. So patients need to be very aware of what they're getting, and also has to do with the bonding. Like whenever you bond porcelain to the enamel, which is the outer layer of the tooth, you have a really good bond that can last you many years. Now, when you take off that enamel, you have the dentin, which is a different layer that the bonding is not as strong. So now this patient's already starting at a level down here instead of being over here. I don't know, what is, like, you guys experience kind of like the same thing, or?
Yeah, so it's multifactorial. I always try to have the patients position them in the aligners so that the arch forms are aligned properly, but there's some patients that are just non-compliant, or they're getting married in 2 months. So it's an issue of time. So as long as you present to the patient that, hey, it would be better if we could position the teeth properly, but if you're not going to wear the braces, if you just don't feel comfortable with metal in your mouth, you're not going to wear the Invisalign 22 hours out of the day, or you're getting married in 2 months, yes, we can do this procedure, but you just need to understand the risks when we do these invasive procedures.
Yeah, I had a close friend that was that case. I put him on aligners. He decided not to wear them. So I got to a point where I was like, you know what, like, veneers, let's just go with the veneers. But he understood that, I was going to be a little bit more aggressive. But the guy was not going to wear the veneers. So sometimes you have to kind of like decide, like you have to take this route, because the patient, at the end of the day, you have to, it's a two-way treatment. It's not just me or the patient. Like, we both need to agree. So if I propose a treatment to a patient, he's not going to do it, then what good does that do,
Yeah, I think patient compliance is really important, especially, Dr. Bart mentioned, especially when patients do get veneers cemented. What is the most important factor to take into consideration when it comes to their home care and regular visits, and how important is that in the patient, the longevity of the veneers? And that's really important to consider as well. A lot of patients can forget about that, right?
I agree. And as long as, like we mentioned earlier, that the conversation was had, okay, so ideally we bond on enamel. So meaning the arch form's perfect, we're doing minimal reduction, we're bonding on an ideal optimum surface in order for the restoration to last 15, 20 plus years, as long as they're taken care of and they're coming in for their proper hygiene visits and they're not chewing rocks or trying to go crazy, because there's patients that have pica and they'll go and do stuff, right? So, but having that conversation of, hey, this will lead to an optimum restoration, I think is very important. Like Dr. Santos mentioned earlier, having that talk with them to say, these are the risks, right? So we can do these veneers, however, the reduction is going to be more. It might lead to sensitivity, right? So it might lead to that downhill spiral over time if they don't take care of it, where they'll now need a crown or a root canal, etc., right? So just having the conversation, having the patient be willing to think about their options prior to treatment is the most important.
And not every patient is a candidate for smile design or veneer therapy. And we talked a little bit about full mouth reconstruction and the difference between the two. So I think a lot of patients have misconceptions about that, where as a patient who needs full mouth reconstruction would come in and assume that they are a candidate for veneers. And so it's important to also remind the patient that it's very comprehensive, interdisciplinary, involving multiple specialties as well, root canal therapy, extractions. And so I think that's a very, very common misconception with patients. So if we want to talk a little bit about more what you think full mouth reconstruction is and how you would describe it to a patient, I think that would be very beneficial for this talk.
Yeah. So you're basically born with 2 sets of teeth. Your primary set of teeth, your baby teeth, and then your adult teeth. What happens is if they're not properly aligned, you're going to get uneven wearing of the teeth. So what happens is with over time, your bite can become, collapsed, and that can present with issues with TMJ, pain, and that's when the discussion needs to be had is, listen, I know you want to get beautiful teeth on the top, but in order for that to work out, We need to complement the bite and even that out and balance it out. It's like having, I got 190K miles on my car. And if the front tire goes, I know I just can't put one tire. I got to replace all four because, I have all this wear on the other teeth. If I put one brand new tire here, it's probably going to pull towards the other way because I got one brand new tire and the other three have 40K on them. So same with teeth. You need to balance the bite out aesthetically. That's why you need to go to a trained dentist that not just sees, 2, 3, 4 teeth, to see the entire picture, facial analysis. Are my overclosed? What does my bite look like? Many factors.
Have erosion.
Yeah.
Some patients that have gastric reflux that's severe will erode their teeth and then secondarily grind at the same time, which then leads to severe wear. Right? And they're having sensitivity, exposed nerves. And these kind of patients, they need a full mouth reconstruction to protect everything and replace what's missing. I think a lot of patients that come in, they're like, oh, full mouth reconstruction. If someone's a severe grinder, guess what? They already did majority of the reconstruction.
And a lot of them don't realize that they have parafunctional habits until they go visit a dentist.
Agreed.
So yeah, it's a very important factor to consider.
And I think that also the main thing has to do with the training. So we all train kind of similar. So if you don't know something, you're not going to trim and blend that. So a lot of patients, they go for the aesthetics. They only care about the front six, the smile. But if you're not properly trained as a dentist, then you will not be able to diagnose correctly. For example, when I have a patient coming in with a broken tooth, my main concern is not like, okay, let me replace the tooth. It's why did the tooth break? What's the main reason? Because it's like I mentioned before, if your natural tooth broke, why would my porcelain be stronger? So a lot of dentists, they're like, okay, we're going to use zirconia, which is a metal, it's a stronger material. They put this in your mouth because, it's not going to break. Yeah, it's not going to break that tooth. It's going to break the opposing tooth. So at the end of the day, it's like, it broke for a reason. What is the reason behind it? So the more you know, the more training you do, you start thinking differently. So I get a lot of patients that come in, they want to do 4 veneers, and then they get this huge treatment plan. But it's like, why? Like 4 veneers won't do it because I'm going to give you aesthetics today, but it's not going to last you long. In a year, you're going to break them. So in order for you to get the aesthetics that you want, sometimes your treatment can become a little bit more involved. And like you mentioned, it has to do a lot with, the wear. It has to do a lot, are you have any acid reflux? Do you have any damage? So you have to assess every single point to give the proper restoration and the proper material that you're going to use. So it also has to do your knowledge of materials. So, I learned, so Dr. Ferry, he's my mentor actually. So I learned a lot from him. And one of the analogies that he told me from the beginning was, using different materials. He said, I'd rather have a material, use a crown, that the crown breaks because I can always replace the crown. But if I use this really strong material that the tooth break, now we're having a bigger issue. So materials are very important as well whenever you're planning these cases.
So one thing that I really love about dentistry is how transformative and unique it is per patient. And I know that patients come in and they all want a beautiful smile. I think that it's definitely something to consider. Also, I think everyone has a different perspective on what they think is beautiful, especially when it comes to proportions and the status quo. So I think we should talk a little bit about what constitutes a beautiful smile.
I think it's a personal opinion.
Right.
Right? Because some patients will come in, like Dr. Santos had that patient that wanted to have the toilet bowl white smile. And other patients that want to have a more natural appearance that didn't look like anything happened to them. And some patients want their teeth to be all straight across, and others want to have, a little bit of misalignment. And it also depends on culture. For example, for a long time in British cultures, their teeth were always crooked and they had spacing, and they wanted it to be that way. They wanted it to look as natural as possible, whereas some patients want it to be as unnatural. Just kind of like they do body changes and they'll do different things to their body to make it look a little bit different. And it's really objective to the person. What is your point of view on that, Dr. Bird?
No, I agree. It's a personal question. You'll have those patients that come in and, I've done cases where they want longer, whiter teeth, but keep the space in between my 2 front teeth. You won't see that on my Instagram, but, we've done those cases and it's just...
And it's characteristic for the patient.
Exactly. It's, the first question I always ask when I meet a patient is, do you love your smile? And if they love it, I love it too.
Exactly.
So it gets very, very personal when you start to talk to the patient because, beauty is in the eye of the beholder, Some people want the bleached white. Some people want the natural shades. Some people want the big, robust, bulky, overbulked teeth. Some people want a little bit of translucency. You got to find that, personal, touch that they want to apply to themselves and where they see themselves as, picture perfect.
And then going on that, it also, like I mentioned before, it has to do with what you like to do. So pick the dentist that does what you like. If you like translucency and this guy has a lot of translucency, pick that dentist. Like pick the right artist for you. Because everybody's been mentioning, it's beauty. Everyone is different. So every smile design is going to be different. So just pick the right artist. That's all.
So let's talk a little bit about discrepancies in pricing for veneers depending on clinic, location. I think there's a lot to be said about this as well, and I think patients would have a lot of questions about this.
When patients have the question on pricing, we talk about education, how well your practitioner's been educated in what they're doing. Secondarily, what labs are they using? Not every lab is the same. An analogy I like to use is tailored suits. So you could go to Macy's and you could buy a suit off the rack and it'll fit you, but it's not going to be perfectly cut for you. Whereas if you go to a master craftsman tailor, they're going to measure you. They're going to make sure that suit fits you like a glove. And that's really the key to cosmetics and using the right lab that'll make that bespoke smile just for you. It's a one-on-one custom smile. And that in and of itself, the mastery of that craftsman also will increase the price because the overhead of that lab is going to be a lot higher because now we have a craftsman that has 20, 30 plus years of experience making each tooth individually by hand, putting each tint, each groove, and making sure that it looks as natural as possible. Whereas there's other labs that'll just use a mill and it'll be one colored and that's it. Similar to getting that suit off the rack. And in my opinion, I want to have that custom tailored suit. But everyone's different and their price ranges are going to be different according to the patient.
No, and it also has to do with the culture. For example, in Miami, a lot of people, we're from Miami, so a lot of people here, they go to South America, they go to different clinics here in Miami where they do, it's like a set number. Everybody has this 20 in their mind that they need 20 teeth. And I always tell patients, remember, once you put something on a tooth, that's for life. So sometimes your smile only needs 10, only needs 4. I've had a friend of mine that actually, I told her from the beginning, I want to do your smile. She had 4 teeth that needed to be perfected, just enhanced a little bit because it was naturally, they were smaller, she had gaps. And I was like, if I do those 4 teeth, your smile's going to be beautiful. She went to Colombia. She got 20 teeth, toilet bowl white. She came back crying. And she was like, Oscar, take all these things off. So I had to remove all of them. Then I did the 4 that she wanted. And her smile is beautiful. So everything is, and also with the pricing, what she paid in all these places to getting all this teeth done, that's my lab fee for 4 or 5 teeth. So you also have to pick, like you mentioned, it also has to do with the lab, who's making your teeth. You have a machine that at the house is gonna make them? Because if that's the case, you look at these Instagrams and you see, everybody has the same tooth. Women, men, everybody has the same exact tooth. And that's not how it should be. The teeth should be something personalized. So when you pick this dentist that works at a higher end level, he's going to have a lab and a technician that is very experienced, like Dr. Freddy mentioned, that is going to make something that is for you. And no one else in the world is going to have that tooth but you. So design is also very personalized.
What are your thoughts, Dr. Bart?
Along with the education, I feel like experience is big. And not just experience that the dentist has, but the patient's experience. Because you don't want to spend $5,000 a tooth and come to a shack, and it's just the front desk person is the assistant, is also the hygienist, is also sterilizing, right? You want, there's the Holiday Inn and then there's the Ritz-Carlton. There are people that stay at the Holiday Inn, it has 2 beds, has a sink, has a shower. So does the Ritz-Carlton. But if I have a big meeting that I need to execute, I need to sleep well, and I need the special accommodations that are going to help me wake up and feel refreshed, then I'm going to stay at the Ritz-Carlton. If I just need a bed to stay and just rest my head for a couple hours, then stay at the Holiday Inn. But when you're going to get that smile, you know, that you dreamed of, and this is going to last you a while, you want to go through that experience where that dentist is by your side through that journey the entire time. I give all my patients my cell phone. It's my cell phone I've had since high school. You know, if something's wrong, call me, text me. I will FaceTime you. I'm easy to find. So that's just the way it is. If there's ever an issue, like, contact me. So communication is big. And I just feel like that experience, because if you're constantly hiding behind a front desk or your assistant, you know, this is my assistant's phone number, this is the front desk, then that's when problems arise. You know, if you don't like this color, you don't like the shade, is it too small, if it's too big, just come in. Let's fix that.
Trust too, right?
Yeah.
So at the end of the day, just having them know that, you know, not only am I investing a lot to take care of something that maybe I was worried about my whole life and I finally saved up, or now I'm actually able to do it.
Yeah.
Finding a practitioner that cares enough to give you their number, to call them, so that they know that they have someone they could contact in case of an emergency. That's something that gives them comfort. Right?
Yeah.
And at the end of the day, we're healthcare professionals.
Yeah.
No matter what we're doing, cosmetics or general dentistry, at the end of the day, we need to care for our patients.
Yeah.
And giving them that bespoke customer service is extremely important, making sure that they're cared for, making sure that the patient knows that they're being listened to, right? And I think that's very, very important, which unfortunately some practitioners or some offices don't do. They don't give them that wow factor, right? They don't give them that Ritz-Carlton experience. And I think that's also goes hand in hand with pricing. And I think that's something that's important.
Very good point, yeah.
Thank you all for tuning into this dental talk. I hope it was very informative for all of you. If any of you would like to contact any of our dentists here, feel free to follow us on Instagram, and we are more than happy to talk to you and give you any advice as needed. My Instagram is Dr. Melanie Rosalia.
Mine is Dr. Feti, F-E-T-I, and I'm at Sportac Dental Group in Delray Beach, Florida.
I am Dr. Sanchez. My Instagram is Dentistry by Oscar, and I work at Implant Center Miami in Bay Harbor.
And I'm Dr. Santos, and my Instagram handle is DJ, the number 2, B Santos, and I'm also at Spodak Dental Group.
Hope you guys enjoyed the chat. It was a great time. Thanks, guys.
Yeah.
Cheers, Arauz.